Hello, I'm Dr. Joseph Cerna, and I'm a general practitioner located in Southern California in Santa Ana. And I have to excuse myself that 2 years ago I left a clip which was incomplete, dealing with fibromyalgia, restless legs, and chronic fatigue, which is an encephalitis, myositis, neuritis, and an immunodepression. It's been 24 years experiencing these cases here in this area ever since I've arrived. And having caught this myself, I should say this is appears to be a form of airborne infectious mononucleosis, which is quite contagious. There appears to be a new peak every 3 months, and it hasn't stopped since I can recollect. So, for starters, I should say that with this clip, I mean to expose what this disease is from a clinical point of view, with all the limitations that you've all encountered, all these negative exams. So you really do need a clinical eye for this. In addition, I'll tell you towards the end how to treat it, and successfully. The treatment is a little bit up to you. It's a little take it or leave it. I can't make myself responsible for anyone wanting to incur on this treatment, but with all my patients it's worked, and it's extremely simple. So, initially I have a patient coming in who has just acquired this virus and complains of neck pain. Usually the left side of the neck, and within a week or two, the left side of the thorax, the pectoral, the deltoid, the shoulder blade are hurting, and within 2 to 3 weeks it reaches the calves, and you end up with your restless legs. It, for some reason, likes to make the left side of the body more painful than the right. So, I'd say more than 9 out of 10 folks are complaining of left-sided body ache. And this virus goes to the brain. Some years ago we did quite a few MRIs where the tentative diagnosis was some sort of encephalitis in the thalamus. Therein lies the pain and anxiety and depression. Above all, anxiety and depression. It's an organic anxiety and depression with this encephalitis. And all the symptoms of anxiety and depression are there, but it's organic. When I tell my patients you're short-circuiting upstairs and you're overreacting to the environment. So the sleep disturbances, the strange dreams, the problems concentrating, the irritability, it goes on. And of course most of the patients being treated with anxiolytics and antidepressants, somewhat successfully, but without any true improvement. So it goes to muscles, brain, and nerves. It seems to each one of these waves has its own little idiosyncratic likings. Quite a few of these like to go to the eye, and there's difficulty in focusing. The pupils don't constrict as well. Also, it seems that there's quite a few of these waves that ends up affecting the vagus, and you end up with more acid production, delayed gastric emptying, and the reflux, which is being treated with all this medication for gastritis. In addition, the branch of the vagus goes off to the heart, slows it down. There's bradycardia. There can be dizziness, lightheadedness with the bradycardia, the slow heart rates, and palpitations. It picks up from another part of the body, and it accelerates the heart. So you have brain muscle nerve swelling. There's other nerve sites, such as the erectile dysfunction. There's quite a few men, most of them I'd say, will mention, once asked about erectile dysfunction, retrograde ejaculation, and just overall debility. So, and I've mentioned the restless legs, the cramps, the spasms. But more importantly, once the damage is done to the brain, muscles, and nerve, What's overlooked is something that leads to in the long run to the patient's symptoms, meaning that there is a leukopenia. This is very important. Quite a few of the patients, when you draw blood, you find that the white blood count is below normal. So the white blood cells aren't attacking bacteria as it should. Normal bacteria we're talking about, not bacteria that should cause problems, but normal bacteria that's located in the nose, throat, bronchi, and uterus, which is clean, ends up being a place where bacteria makes its way to. So if you read about chronic fatigue, they'll mention the allergies, but more important than the allergies is a leukopenia with a septic state, leaving the patient in a septic state. And with this septic state, you end up with low blood pressure and the foggy mindedness. The bacteria can't make its way up to the brain because there's a blood-brain barrier, but bacteria has excretion, and that seems to make its way up to the brain, and you have the cloudy mindedness. And when you have bacteria and the excretion, the symptoms flare up. And of course, what's mentioned, working out, having sex, drinking alcohol, that all lowers the immune system, and you have bacteria. But if you draw blood, you won't see an increase in the white blood count or anything like that. Therein lies the treatment with just symptomatic treatment with anxiolytics, analgesics, anti-inflammatories. So the first time I caught this, I was quite feverish for some time, and after having tried so many things, I decided to try Dr. Linus Pauling's 10,000 milligrams of vitamin C a day. Dr. Linus Pauling was using it for cancer. It doesn't work for cancer, but it seems tailor-made for this problem. It works like a charm, and 10,000 milligrams seems to be some sort of magic number for this. Excuse me, for this problem. So, if you use one tablet a day, like the bottle says, you won't notice any difference. 2, 3, 4, 5, 6, nothing. 9, 10 kick in, and you will notice difference. But prior to all this, how to get an immediate relief from all the symptoms, an antibiotic, and my favorite antibiotics to open patients' eyes are I use quite a bit of generic augmentin and quite a bit of generic levaquin. These antibiotics will cover bacteria from the nose, throat, bronchi, and uterus. So within 2 to 3 days, the patient feels much more relieved. The foggy mindedness is relieved. The sleep, the pain is gone in varying degrees, but very, very, very much relieved. Only to recur again if you don't go on to take the vitamin C. So the patient's convinced, he feels better, the pain is gone, the women's periods are normal, the low back pain is gone, the pain on intercourse is gone, they resist more physical exertion without feeling bad. So after the antibiotics, by this time they're convinced to take 10,000 milligrams of vitamin C a day. I've had patients take 20 to 30,000, and they've had absolutely no problems. The stones in the urinary tract, I've seen none of that. They've all improved dramatically. 10, 12 a day is a good number, I tell them, and that's for bacterial overgrowth. Also, there's fungal overgrowth, depending on the wave of the virus and its predilection. Vitamin B complex came in next. I started off with thiamine because one uses thiamine for alcoholics, and that seemed to help a little bit. So So I tried B1 and B12. That seemed to help. I said, let's go all the way. Let's try B12 100. Also large amounts, 10 tablets of those a day. It worked even better. It kicked in very, very much. It seems that it helps muscle, brain, and nerve swelling to improve, decrease, and improve rapidly. Up until not too long ago, they would say that the brain, muscle, nerve damage is not going to recover. And not too long ago, we started to see that it does recover. It appears that this B complex helps very much. It's over-the-counter B complex 100. The only folks I've seen with problems with the B complex are those that have used the shots from Mexico that have had problems with B6. So anyway, once again, it's take it or leave it. So I tell my patients, okay, 10,000 milligrams of vitamin C spaced out after meals a day, another 10 tablets of B complex 100, not the super B, just B complex 100 spaced out after meals, or more. And if after 3 to 4 weeks of taking it they're not noticing any improvement, forget it. I can't recommend this for you that are listening, but it's worked with my patients. But I can't recommend it, but it's worked with my patients. Okay, so burn patients, you use a lot of protein. I tell my patients to patch them up, the destroyed tissue, the tissue that's it's still surviving after third-degree burns. With this, it works very well. I tell my patients take a third in a glass with low-fat milk 2 or 3 times a day, or I like amino acids, third in a glass or fourth in a glass with water 2 or 3 times a day. It works very well. It patches the patients up, I'd say. They do much better and without protein. In addition, I tell them to take zinc. It's a virus, but that's a minor concern. Anything that's achy that goes away with warm water when showering will go away very quickly by stretching the neck forward, touching your chest with your chin, the back, standing on your tiptoes with the calves, contracting the calves. I tell my patients, don't work out for 3 to 4 weeks, take your vitamins, and then slowly but surely start to work out. I overlooked something very important, something that's pathognomonic with this. That means it's extremely characteristic. When this virus is caught, it goes to the pharynx. It makes its mark on it by swelling it and leaving it painless. Therein lies the snoring and the sleep apnea. But very characteristic of a pharynx, of a normal pharynx, should be an upside down U type of form when saying ah, and when it's caught this virus and it scars the pharynx, it turns into an upside down V shape in varying degrees. Usually when it's recent, the pharynx is swollen and it feels like one has mucus stuck to it, but it's the mucosa stuck to the fauces. And I should say not stuck to the fauces, but that's swollen and are part of the fauces, not the not mucus. So that's a giveaway for me when I see the throat like this. In addition, strange things I have seen that are kind of in the air. Well, for treatment, I think in the future, to diagnose, because everyone wants some sort of lab report. I think what we're going to end up doing is quantifying bacterial excretia in the blood. I think that'll be of enormous help. Very simple, and it'll go to to the bottom of all this. And for treatment, I think in the future we'll be seeing perhaps removal of